All right, in this video, we've got diseases caused by cavities. We got it by Dr. Wheels as an animation here. Let's see what they've got for us. This is interesting.
Bacteria originating from cavities can initiate gum infections, leading...
Interesting. First thing I'd pause, cavities don't necessarily cause gum disease. So the differentiator is that the bacteria that causes cavities is eating or eroding the inside of the teeth, and the bacteria or inflammation that causes gum disease is usually different. They're both bacterially caused, but I definitely would say those are not the same thing. Those are two very different and separate disease processes.
Gum infections, leading to gum disease, which is linked to diabetes and systematic inflammation. If left untreated, these bacteria may eventually...
Yeah, this is totally true, but not crazy common, but there's definitely a couple horror stories out there. The bacteria in our mouth is meant to stay in our mouth. And so this might sound a little bit weird, but you learn that inside the mouth and through our digestive tube, even though it feels like it's on the inside of our body, is actually not on the real inside of our body. And so we want to make sure that bacteria that's in our mouth, in through our throat, or in our stomach, or in our gut, stays where it's supposed to be. We don't want that to cross into the bloodstream or the body, and that's when we have bad effects. So when things break down in the mouth like cavities or gum disease, that bacteria can cross into the bloodstream, and that's what causes issues.
A risk of severe life-threatening infections. When addressing cavities, one option is ceramic crown restoration. This procedure entails completely encasing the tooth with a custom-made crown. Although it involves more extensive tooth removal, crowns offer superior durability and are recommended for large...
Yeah, I totally agree. When we have a large cavity on a tooth, the big differentiator for us in the dental world is we really look at the percentage of a tooth that is filling versus naturally left over, basically. So when we remove a cavity from a tooth, in the dentist's mind, they're asking, is this tooth less than or greater than 50% tooth to cavity or tooth to filling ratio? When we get above that percentage, when the filling is more than 50%, we're usually going to lean towards something like a crown or a cap or onlay, which are all similar procedures. And those strengthen a tooth by kind of wrapping and surrounding them versus a filling, which kind of fits on the inside and can repair things. Does really well when they're small, but as they get larger, they have more issues.
Teeth. Alternatively, composite filling restoration involves removing decay and directly filling the affected area with a tooth-colored resin material, preserving the natural appearance of the tooth. This option is suitable for smaller cavities and less extensive damage.
Yep, once again, right about that 50% is kind of the critical number, and sometimes there's some other factors about how many surfaces or how many sides of the teeth are involved that can also affect things. Interesting video. I like this one.